All right, you're on deck.
Good morning, everyone. Thank you so much for joining today's session. My name is Lindsay Green, and I am part of Coordinated Care's community education team. So today's session is going to be all about how youth who are in foster care and alumni of foster care can access Medicaid services. And also for those of you who might work with other youth who are not in foster care, but might be having questions about how to enroll in Medicaid or what Medicaid covers, we'll go over some of that information today as well. As we go through today, please feel free to ask any questions that you have. You can type it in the chat, or if you prefer, you can come off mute and just hop in whenever there are questions that arise. I'm going to go ahead and share my screen. And also, in the chat box, I went ahead and put a PDF of today's PowerPoint presentation. At the end of the session, we'll have some time for Q&A, and I will add in some other resources and flyers and things for you all to have as well. And if more people join late, I will repost the slide deck in the chat as well so that they can have access to it. Okay, let's get into presentation mode here. Sorry, give me 1 second. Okay. Oh, what happened? Let's do a slideshow. Okay. All right. So here at Coordinated Care, we like to take a moment at the beginning of every webinar or training that we do to acknowledge that we are gathered on the ancestral land of Native communities. And because we are all statewide today and joining from different places, you will notice that, that this land acknowledgement is a little bit more broad to encompass all of Washington state. So please join me with a land acknowledgement this morning. We are gathered today across the ancestral tribal lands of Washington. We honor the strength and resilience of tribal people and express gratitude for the many gifts and learnings that they bring to our communities. Okay. So today we're going to talk about, the Apple Health Core Connections program at Coordinated Care, which serves foster youth and alumni, talking about program and benefits, what happens when a youth enters care, what kind of services Coordinated Care can offer around healthcare coordination, how to contact us, who to contact, and lots of time for questions and answers. And not on here is also just behavioral health services. We know that can be a challenge to navigate the behavioral health system. So we'll be talking quite a bit today about behavioral health as well. Okay. So I like to start with just kind of explaining Medicaid a little bit. I think sometimes that can be really confusing, right? So Medicaid is the program that provides health coverage to lower income individuals and families, right? So Medicaid here in Washington also is called Apple Health. So sometimes you hear people say, oh, I have Medicaid. Sometimes you hear Apple Health, right? Those two are really synonyms. They can be used interchangeably. Apple Health is the name of Medicaid here in Washington. And the way Medicaid works here is there are 5 managed care plans. So there are 5 MCOs, or managed care organizations, that the state contracts with to provide, the Medicaid covered benefits to Medicaid members across Washington state. So Coordinated Care is one of those 5 managed care organizations, but we are the Medicaid plan for children and youth who are in out-of-home placement, adoption support, extended foster care, and alumni of foster care. So the way that benefits work for alumni of care, it doesn't matter whether or not they are actively enrolled in extended foster care. They are categorically eligible for Medicaid through the month of their 26th birthday. So if they were in care on their 18th birthday, they are covered by Medicaid through the month of their 26th birthday. They don't need to take any action. They don't have to provide any kind of financial information to the state. They are eligible because they were in foster care on their 18th birthday. And then also children and youth who are reunified with their parents can remain with Coordinated Care 1 year post-dependency as long as their parents meet income and resource requirements for Medicaid. So within Apple Health Core Connections, we have about 25,000 members statewide. And for those of you who are joining from counties where maybe coordinated care doesn't offer general Medicaid, we are still the Medicaid plan or the managed care plan for foster and adoption support statewide. So this is a statewide program with about 25,000 members. There are a few exceptions to enrollment. Native youth are not automatically enrolled in managed care. So if a Native youth is entering foster care, they can choose to enroll in the Apple Health Core Connections program, but they are not automatically enrolled. Instead, they have what's called fee-for-service Medicaid, and we'll be talking more about that today too. Other exceptions to enrollment, if a youth goes out of state for placement, then they don't receive Washington State Medicaid. There's a process to get them health coverage in the state that they are going to. For some youth who maybe entered foster care in a different state and then they moved to Washington, their eligibility for our program depends on their 4E eligibility. And then the other one that you might encounter some in your work is youth who are in a JRA or detention setting, right? While they are in detention, they are not covered through coordinated care. They receive medical through the through JRA or through the detention center, and then as soon as they are released, they are automatically kind of re-enrolled with coordinated care. So there's never a gap in coverage for those youth who might be going into a detention center. Okay. So I'll pause there just in case there are any questions. Ooh, okay, so there was a question about youth who are in federal foster care. Are they eligible for coordinated care, and when would that end? So I'm wondering if that would be maybe like unaccompanied minors or youth who, yes, unaccompanied minors. Yeah, I'm gonna give you some information on that today in today's presentation about how to sign them up for Medicaid. They are not covered through the Apple Health Core Connections program, but as we go through today and we're talking about what Medicaid covers here in Washington State, that's the same regardless of whether or not the child is in, you know, one of the other managed care plans, if they're in general Medicaid, if they're with Apple Health Core Connections. So when we're talking benefits, it'll be the same benefits, you know, for the most part across the board. So regardless if the family has one of the other MCOs or coordinated care. But we'll talk about how to get them some services, where to go for help. So if you are working with a youth who you think really would benefit from Medicaid and does not currently have Medicaid, but they're not in foster care, or they're not an alumni of foster care, so they don't qualify for Apple Health Core Connections, that youth may still qualify for regular Apple Health. And so you can contact that phone number listed below or access the lawhealthplanfinder.org website to help that youth enroll in Medicaid. Okay, so some basics about the Apple Health Core Connections program. Really at the core of what we do is whole person health across our systems of care, right? So we want to see integrated physical and behavioral health coordination, right? The mind and the body are connected. We want our members to have access to all of the healthcare services, to be really treated as a whole person. We are recovery focused, right? Every individual has opportunities for recovery to be stable and thriving in their own community. Being trauma informed, we know that the youth who are in our Apple Health Core Connections program likely have experienced trauma or ACEs, and so recognizing the impact of trauma on their well-being and on their health. We want to ensure that every youth in our program has a primary care provider that they can go to receive preventative care and regular health care services. And we want to ensure that our members have access to the right care at the right time. So especially with access to behavioral health services like WISE, right, and also preventative health care and specialty care when needed, and really encouraging best practices and evidence-based practices. So just a little aside on that, I was really excited this year. We were actually able to bring a TFCBT, so trauma-focused cognitive behavioral therapy, which is an evidence-based practice treatment. We were able to bring in a national trainer and train 23 providers across Washington State in TFCBT, and we're hoping to do that again in the near future with even a bigger cohort. So we're a big supporter of using evidence-based practices to really see good outcomes for these youth. We have staff located across the state, so Seattle, Tacoma, Yakima, Spokane, Wenatchee, and other places as well. I'm actually physically located out of Snohomish County, so fairly close to the Seattle office. I am part of the community education team, which you see on the bottom there, and we're able to offer training and support to foster parents, caregivers, child welfare organizations, healthcare providers, CASAs, court staff, educators, right? Lots and lots of organizations on lots of different topics that are related to child welfare. So my colleague Heather Perry will be offering our secondary trauma and self-care training this at the next session, so I think at 10:30. And you are more than welcome to reach out to me if you have any requests for training for your organization or for any groups that you are a part of. Most of our training is around, trauma-informed care, resilience, ACEs, secondary trauma and self-care, and some other topics really related to well-being for these youth in our Apple Health Core Connections program. Again, right, our main goal is make it easier, right? We want to help youth access the care that they need, or help caregivers and caseworkers at DCYS really make sure that kids are getting access to needed physical and behavioral health services, so that hopefully we see better health outcomes, fewer placement and treatment disruptions, and just, overall well-being is improved when the health of the child, their healthcare needs are being met. So this is a helpful tool, right? If you are working with a youth and maybe they're saying, hey, like I'm having, I don't know, some kind of rash or some kind of healthcare need, and I need to find like a dermatologist, or, you know what, I haven't been to the doctor in a couple of years. I'd like to find like a primary care provider that I could go to. And then you say, well, hey, do you know if you have health insurance? And they maybe say, yeah, I'm 18 and I was in care on my 18th birthday and I still have coordinated care, right? You could help that youth go to our website, coordinatedcarehealth.com, and then at the upper right-hand side is a Find a Doctor button. So you click on that, and then you're able to search. What I like to say is cast a wide net, right? If you get too detailed, sometimes you don't get as good of results. And if for whatever reason you are not finding a provider that is working out for that youth, maybe you help that youth call a couple places, and all these providers are saying, yeah, we're not taking new Medicaid patients at this time, or, we have a 6-month wait list, or whatever else it might be. What you can do is call us. So 844-354-9876. You'll see that phone number probably a dozen times in today's presentation, but give us a call and our staff can help that member really find a provider who is, going to be a good fit based on their needs, and also can do some of the legwork for you if you're having a hard time finding a provider that's accepting new patients at this time. So the first step, go to our website. If that doesn't work for a youth and you're hearing anything like, I am having a really hard time finding a provider, we really highly encourage you to give us a call so that we can help do that legwork for them and help them locate a provider. Okay, so integrated benefits, right? What does Medicaid cover here in Washington? Behavioral health and physical health. What are those benefits that are covered by Medicaid? So this is what the ID card looks like for Apple Health Core Connections. It's got 2 Medicaid numbers on it there. You see the Medicaid ID number, which is their Provider 1 or fee-for-service Medicaid ID number, and then their coordinated care member ID number. And so they can take this card with them. If they don't have a card, you shouldn't actually need your physical card to be seen for services. However, we know some providers will say we want to see the original card. So if a youth doesn't have their ID card, they can either call us at that 844 number, or we also have an email box that they can email and request a new card, or request care coordination or assistance that way by email too. So you'll see that email a couple times in today's presentation. And this is what the ID card looks like. So here's just sort of a general list of what's covered by Medicaid. So again, this applies for youth, across the spectrum of if they have fee-for-service only, or if they have you know, one of the other managed care plans. These are some of the Medicaid benefits here in Washington. The medical services, doctor office visits, urgent care, vision exams. We're going to go a little deeper on that in just a minute here. Medications, prescriptions. We're going to go deeper on pharmacy benefits as well. Hearing exams, hearing aids, durable medical equipment, and they can get a lot of that DME delivered right to their doorstep as well. Hospital care, home health, ER visits, physical therapy, other specialty therapies, you know, speech, OT, those kinds of things. Lab tests, X-rays, transplants, family planning. We're going to go a lot deeper on family planning too as we get into our adolescent program as well. Disease management services, transgender benefits. That's one of the handouts that I'll provide in the chat at the end of today's session, but just sort of a breakdown of what's covered. Behavioral health, outpatient and inpatient, and then drug and alcohol treatments, substance use disorders are also covered by Medicaid. So again, you know, if you're ever working with a youth, this can be kind of a helpful guide for them if they have questions or maybe aren't really used to navigating the healthcare system, right? Urgent care is great for cuts, burns, sprained ankles. You have a cold, but you can't get in with your primary care provider. Examples of when to use the ER, right? Heavily bleeding, somebody's unconscious, severe shortness of breath or can't breathe. So it's just kind of a handy guide there. If a youth is ever confused or has questions about, you know, where should I go? Should I see a doctor right now? Can this wait for me to go to the primary care? They can actually call us 24/7. So it's still that same 844 number. And if they're calling after hours, they press 2 for member services and then 2 again for the nurse line. And then they can speak to a nurse 24/7 to ask, you know, some questions about, hey, do you think this is something I should go to the ER for or to urgent care for right away? Again, urgent care and ER visits are covered, but we encourage our members to, you know, utilize the right level of care. If they don't need to go to the ER, you know, we don't want members having to wait for a long time or be exposed to more germs or kind of just more of a medical system than what they need, right? If urgent care or PCP can do it, we'd like to make sure they get the right care at the right place. So pharmacy benefits, right? Prescriptions must be from an in-network pharmacy. There are medications out there that require a prior authorization. So you might run into a young person who's having a hard time with a medication that they need. And if that's the case, again, encourage them to reach out to coordinated care if they're in foster care. If they're not, you can ask them, hey, what managed care plan do you have, right? Do you have an ID card for a different managed care plan? And then encourage them to call their managed care plan directly for some assistance with that. And the other thing that many people don't know is that Medicaid actually covers many over-the-counter medications as long as there is a prescription. So you can't just go to the pharmacy and, you know, pick up over-the-counter medications and have it covered. But what you can do is when you go in for your annual wellness visit is you can ask that provider to write you a prescription for a number of over-the-counter medications, and then the pharmacy should fill it. Sometimes providers don't know they can write those prescriptions, and sometimes pharmacies don't know that they can fill them. So again, if the youth is ever running into an issue around that, they can reach out to our team and we can help with some education to ensure that they get those benefits that they have. So here's some examples, right, of some over-the-counter medications that are covered with a doctor's prescription. Over-the-counter pain relief like ibuprofen or aspirin, antacids, allergy and cold medicines, athlete foot cream, diabetic testing supplies, prenatal vitamins, lice treatment medication. And in addition to that, DCYS does have contracts with lice removal services. So if the youth is still in extended foster care or maybe under 18 and in foster care, you can also reach out to the caseworker for information about that as well. And there are many more than that. So there's the link to the preferred drug list, and you can see all the over-the-counter medications that are covered. So if a youth is placed with a relative caregiver or you know, with a family, we really encourage families and caregivers and our older youth to use this, right? We don't want them having to purchase this out of pocket if it is a covered benefit for them. Also, in regards to COVID-19, coordinated care has made some changes into how our pharmacy program works, which means that there are even more medications that are listed on the 90-day maintenance list, And those medications can be delivered to the home through mail order or through pharmacy home scripts. And so there's a link there to getting some more information about how to set that up. But if, a youth or a family is trying to, avoid contact and going out to the pharmacy quite as often, that is available to them. So even a little bit more information there. I'm not going to go into this too deep. I don't think this is going to be too applicable to you all, but we just want to make sure if you're working with a family, you do know that they might be able to set that up. So vision health benefits. So if they are 20 or younger, they get 1 eye exam per calendar year and hardware, so glasses plus lenses or contact lenses if it's medically necessary. So that's really one of the key pieces about Medicaid is it covers medically necessary services. So we know many youth would prefer to wear contact lenses for cosmetic reasons, but those are not covered by Medicaid, but glasses and lenses would be. So the hardware is only available for youth who are 20 and younger, right? So once they hit 21, they are no longer eligible for glasses through Medicaid. Oh, the link isn't in here. I can send you a link too at the end of today's training. I'll plop it in the chat. But by county, it lists providers in the county who are willing to provide discounts for glasses for people who have Medicaid. So there are ways to get some discount on glasses, but they are not covered once that youth turns 21. So we really encourage our youth who are getting close to that age to go get a new pair of glasses if they're eligible, if they haven't had a new pair in a while, and to use that benefit before it goes away. Once they're 21, right, they get an eye exam every other year, right, every 2 calendar years. You don't need a referral from a primary care provider to go see an eye doctor. And other medically necessary eye care is covered in addition to routine eye exams. And I see a question coming up in the chat. Okay, yeah, so there was a comment in there that if a youth prescription is -6 or greater, contacts are covered. Yeah, so again, it's around medical necessity, right? So there are times when contact lenses are covered if it's deemed medically necessary. So that prescription of -6 might be where that cutoff is. I'm not exactly sure where it is, but that seems to make sense. So again, if it's for cosmetic reasons, then contacts are not covered. But if it's for medically necessary reasons, then contact lenses are covered. I'm not going to go too deep into this. We're going to talk a little bit. So when integration happens last year, meaning when behavioral health and physical health were all placed under coordinated care for our foster population, right? It used to be that certain behavioral health services were actually still covered through the fee-for-service system. But now there's integration, meaning the behavioral health services came under coordinated care's plan as well. So here in Washington, what's kind of interesting now is people who were using fee-for-service Medicaid, so maybe adoptive families who chose to enroll their child on their own private health insurance plan, kept Medicaid fee-for-service as kind of secondary coverage, or maybe a native youth who was only receiving fee-for-service, they could choose to enroll in the behavioral health services only, so the BHSO. And basically what that means is this card would be used for high-level behavioral health services. So for adopted children who have Medicaid for secondary coverage, they would actually end up with 3 ID cards. They'd have their primary insurance card from the private insurance, they'd have their fee-for-service card for secondary coverage, and then they'd actually have this BHSO card for secondary coverage for just behavioral health services. So this is pretty tiny, but if you ever see a card that has that BHSO on it and you're like, this youth is having a hard time figuring out when to use this card or what's going on with it, just encourage them to reach out to us. And again, you'll have my contact information, and you can always reach out directly to me as well if you're having any kind of issues. Okay, so with integrated foster care, all youth, right, BHSO, but also just the regular plain integrated plan, right, gives them access to WISE, the wraparound with intensive services, and then for older youth, right, the adults, There's Program of Assertive Community Treatment, or PACT, and then substance use disorder treatment. So outpatient, intensive outpatient, residential detox, and medication-assisted treatment are all covered by Medicaid. So if you are working with a youth who is having a hard time accessing these services, again, please reach out to us so that we can assist them, but do know that WISE is covered by Medicaid. Lower, outpatient counseling services, other behavioral health services are also obviously covered, but so is that higher level through WISE. So for those of you who kind of remember the old system when behavioral health services went through that fee-for-service model, those high-level behavioral health services, you had to access them through your county. That requirement has gone away under this new system. So as of a year ago, youth could access behavioral health services from anybody who was, in network with their managed care plan. So that's really wonderful. But the BHASO still provides a lot of great resources. They provide the 24/7 crisis line for all members or for all people in the county. Those regional crisis numbers, and they also still run that designated crisis responder, or DCR. So the DCRs are the people who can go out and help make a determination about whether or not somebody needs to go in for involuntary treatment at the hospital for either a mental health crisis or a substance use crisis. So if you don't know your crisis line for your region, I highly encourage you to download the PowerPoint and click on that crisis line link there so that you can have the correct phone number. You can provide that to youth. You could post it in your office, right? If anybody is ever in crisis, that's the number you want to call ahead of, other options, right? So calling that regional crisis line can help somebody access some services around, mental health or a substance use crisis. Okay. So what's still under this old fee-for-service system, right? So here in Washington State, most healthcare services, most physical and behavioral health services are under this managed care system, but there are still some things that haven't been integrated yet. So people on Medicaid in Washington have these 2 ID cards, right? So they might have their coordinated care ID card, but then also this Provider One Teal card as well. And the Provider One Teal card can offer a couple of things. We talked about eyeglasses already, and one of the other big one is dental services, right? So dental services are still covered through Provider One. However, if a youth is having a hard time accessing dental services, they can still reach out to us, and we can still work with them on trying to find a dental provider. That's probably one of the issues that we see people run into fairly frequently, right? Needing some help accessing dental services. Transportation for medical appointments is another one, right? We're going to talk more in depth about that program in just a minute. And then you see transgender benefits on here again. So again, I'm going to provide you even more information on what transgender benefits are covered, but the basics are, if the youth is needing hormone replacement treatment or anything like that, it goes through the coordinated care, through managed care. But if they are in need of surgery, the transgender surgical benefits are covered through the fee-for-service or Provider One card still. A youth should never, a family should never have to know what card they need to use. But just kind of on the back end, if you're kind of curious about how Medicaid works in Washington, then this is helpful information. Okay, so the medical transportation is done through regional brokers. And this program provides transportation for medically necessary services. They typically request about 7 to 14 days notice prior to the appointment. So you can't call your regional broker and say, I'm a Medicaid member and I need a ride to the hospital, or I need a ride to an appointment this afternoon, right? You have to give them some advance notice. And they will often provide either a no-cost ride, ferry tickets, gas money, bus tickets, right? All those kinds of things might be ways that they will help provide transportation to and from doctor's office visits, dentist visits, hospital for like a scheduled surgery or something like that, and the drugstore to pick up prescriptions as well. So you can click on that link there to see who the regional broker is in your county, and then that's a great resource if you ever hear of a youth that's having a hard time making medical appointments. They can work with the regional broker to get to and from appointments. And I am trying to remember, it's been a while since I helped a younger youth with this. I think that if they are 16 and over, they are able to access that without needing like a parental permission around that. So I'm going to have to double check that. I am forgetting it completely offhand. But for younger youth too, I know there is a process if they're mature enough and able to handle that. They can access that benefit as well without having an adult with them. Yeah, okay, 16 alone to travel via the transportation that's provided. That's what I was thinking it was 16, but I think I've also heard of some situations where maybe there was like a mature 15-year-old that they were able to work out some assistance too. Okay. So a little bit more about the coordinated care model, right? We really see our role as being connected to all of our allied systems, community-based supports, providers, the wraparound services and crisis services if needed, to really put the member at the center of everything that we do, right? So we have lots of teams. We have system of care liaisons. If there's ever a youth that is accessing some really higher level behavioral health services like SLIP or something like that, right? We have these liaisons that are built in to help families navigate that really intense process. And we work really closely with our community-based programs and supports to help make sure that members get connected to all the services in their community that could be a big help for them. Again, recovery-oriented, culturally responsive, self-determined, and focused on whole person. Right, so the patient is the driver of their goals and their care plan. We really engage with members on what their goals are. Right, so we're not setting their healthcare goals. They have to decide what their healthcare goals are, and we want to help them meet those. So pretty quick through this. So if you do work with high schoolers, right, we know, over half the kids entering foster care in Washington State are under the age of 5. However, we also know that, there are youth that are entering foster care as well. So you might be working with, a high school student who is entering care for the first time. And it takes a little while for the system to all work out and for that youth to get their ID card from coordinated care. So in that interim, a couple of weeks, they can use this interim voucher. They should be receiving this with their placement packet when the child is, or the youth is placed in a foster home. But you can see it's on our website as well, and you can kind of see an example of what it looks like. And they just use this interim voucher with them when they go to the doctor for some of those first visits while they're in care and they're with coordinated care. They just don't have that physical ID card yet. If there's any issues, there's some directions for you on what to do. Care coordination, this is really the heart of what we're able to provide for our members, right? Apple Health Core Connections, healthcare coordination staff can help find providers and schedule appointments. And really helping youth figure out how to do that on their own, right? It's not about us scheduling those appointments ongoing. It's about how do we help them get the skills that they need so that they can schedule those appointments for themselves. So the best way to request healthcare coordination is to call us and dial 2 or to email us. So I promise there's the email address. Youth can email us, directly if they're needing some help. If you're working with some older youth alumni members, right, they could email us directly. If you call or you encourage a family to call us, the best thing to do is ask for healthcare coordination. When you call that 844 number, you're going to reach somebody who's going to answer the phone fairly quickly. The call center can help with many, many, many tasks. But if you're really struggling with something and need some kind of more detailed help, what you want to say, what your key words are, your magic phrase is healthcare coordination, right? I am requesting healthcare coordination. And that's what's going to get you over to that team that can really assist. So here are some examples. These are real life examples that our team has worked on over the last 5 years or so, right? A primary care provider made a referral to a specialist, an endocrinologist, but that specialist doesn't have any openings for 6 months. right? We want that child to be seen, and we want them to get the right care at the right time. So, we were able to work on helping to find a specialist that could see that youth sooner. The next one there is really more of a DCYF case example, but the judge denied the request for ADHD medication and ordered the child to be seen by a naturopath. And in that case, there wasn't a naturopath that was in our network in that county, and that caregiver was going to have to drive that child a couple hours away to have that appointment. And that's not the right care at the right time, right? So we were able to help locate a naturopath in their community who could see the child. A teen needs a behavioral health therapist, therapy, but is fearful of men. It would not match well with a male therapist, right? So we have definitely had lots of people call and request assistance in finding a therapy provider who is going to really match the unique needs of that individual. If the youth has a chronic disease, right, we offer some support around how to manage chronic conditions such as asthma, diabetes, childhood obesity, or sickle cell. I'm going to kind of skip through some of these. Again, we can help navigate complex issues, right? That's the key. If you're hearing of any youth who's having a hard time with behavioral or physical health services, we want them to call us so that we can help them. We can help with getting the durable medical equipment and medical supplies set up. Right? Healthcare coordination can be a one-time request, right? Just one time they're having a hard time finding a provider, or it can be ongoing until issues are resolved, and it can be reopened at any time, right? There's no benefit maximum. There's no maximum number of times that you can reach out for help. If a member needs help, we want to be there for them so they can reach out to us as many times as they need. And then some value-added benefits. So what are some other things that are covered? So when we went through, a lot of the kind of covered services, right? That's set by the state of Washington as kind of Medicaid covered services. These are kind of the added programs that are really available for our Apple Health Core Connections members. And a lot of them are also available for our general Medicaid members as well. So the care coordination team, we've already talked about what they can do. Boys and Girls Club. So our Apple Health Core Connections members can access a no-cost membership for Boys and Girls Club across the state as well. The 24 nurse advice line, again, they just call that main phone number, and if it's after hours, they'll press 2 for member services and 2 again to reach that nurse advice line. Start Smart for your baby. If you ever work with a youth who is pregnant, if they fill out a notification of pregnancy, they can enroll in a Start Smart for your baby program, and they can get a no-cost double electric breast pump, as well as a no-cost convertible car seat. So not an infant bucket seat carrier thing, but the convertible car seat that goes from rear-facing and then to forward-facing. Teledoc Partnership. This is so exciting. Teledoc launched a couple months ago now. And it is a way that any member can receive telehealth services. So telehealth is covered by Medicaid, and if a youth goes to a primary care provider that offers telephonic visits or telehealth visits, they can use that. But if they have a provider who maybe doesn't have any telehealth appointments available and they need to be seen, quickly, or maybe their provider doesn't offer telehealth, then Teledoc is an in-network, Washington-based telehealth provider. So it's available 24 hours for non-emergency issues. And you can, connect with a provider without having to travel. So they can set up a Teledoc account via the mobile app or on the website. So they can click on this link. I'm going to drop a flyer or two for Teledoc and how to sign up in the chat. It literally takes like 2 or 3 minutes. In March, I was doing a bunch of outreach calls to our alumni members across the state, and I helped multiple youth sign up for Teledoc, and it didn't take more than 2 minutes for any of them to, download the app and get set up. All they need is their name and date of birth to get set up with that Teledoc account. So what can you use Teledoc for, right? Cold, flus, fevers, sinus problems, allergies, upper respiratory infections. If they want help with smoking cessation, and there's also dermatologists available through Teledoc as well. And then for our members who are 18 and over, they can use Teledoc to set up behavioral health counseling visits as well. So if they are younger than 18, they cannot access that behavioral health benefit through Teledoc. but if they are 18 and over, they can access behavioral health through Teledoc as well. So we're going to talk a little bit more about A2A, or that Adolescent2Adult program, in just a minute. So I'm not going to go over that here. Zero suicide, just know that our staff are trained in the Columbia Suicide Risk Assessment. We do outreach to our members who have ED visits and really help caregivers and members with safety planning, and we will, stay on the phone with them if there's an immediate crisis until crisis services can be put in place, and really helping make sure that youth gets the services that they need based on that risk assessment. So we do have a suicide prevention protocol to really quickly assess our members who are at high risk of suicide or self-harm or overdose. Again, we have liaisons and educators across the state. And these programs are only available to our alumni members, so they are 18 or over, or members of any age that are in adoption support. So meaning the adoption is finalized, and the youth is still primarily on Medicaid and has chosen to stay with our Apple Health Core Connections program. They can access the SafeLink cell phone program. SafeLink is a federal program. Families can access it if they are eligible for Medicaid, or also through TANF and some other benefit programs like that. It is one per family. So for our alumni members that are receiving Medicaid, right, they are their own kind of family, right? They're their that head of household for their Medicaid. So they can access the SafeLink cell phone if they're 18 and over. It is a smartphone now. I'm told it's not, like a iPhone 10 or whatever. But what they can also do is just request the SIM card for it. And then they can purchase their own phone, or maybe they have their own phone. And so then they're just using, the data plan from that SafeLink cell phone. So in response to COVID, they really upped those benefits. I don't know if they've gone back down to the regular level or not. I'm going to put a flyer for SafeLink in the chat when we're done today too. And again, if a member has a hard time signing up for SafeLink, you can reach out to our team and we can assist with that. One of the things we sometimes see is maybe a youth is living at a placement where other people have already signed up for SafeLink, and so it says, oops, so you're not eligible. This household has already had a SafeLink phone. So if they're running into a barrier like that, we can assist to ensure that they get that phone that they need. The rewards program, I'm going to show you this in just another slide, but basically, if a youth is going in for some preventative care appointments, they can actually automatically, it's not something they have to sign up for, the member automatically receives it's like a Visa gift card in the mail with money on it. And every time they do a qualifying, preventative healthcare appointment, they actually get money loaded onto that card. So we don't send out a new card every time. The money just goes onto that card that they have. So they want to retain that card or hang on to it. And they can use it for lots and lots of different things. We've pulled the data. People have used it for Roku, like streaming services. They've used it to, pay internet bills. They've used it for, at lots of different stores for all kinds of, items that they might need. So it's a really great benefit, and I'll show you how much they can earn on the next slide. And then also they can set up an online member account, right? So they can access all their benefits and claims data. They can request a new ID card. They can do all those kinds of things right online through that online member account. So here's the rewards program, right? So for youth that are 21 and older, they get $10 for going in for an annual WellCare visit. And if they are between the ages of 12 and 20, right, we really want our adolescents to go in for their annual checkup. And so they actually get a $40 benefit or reward for doing that. For pap smears or annual cervical cancer screening for members ages 21 to 64, they can get $10. And you can kind of see there's some other benefits too. Annual comprehensive diabetes care for ages 18 to 75, right, $60. So depending on what their healthcare needs are for preventative care, some really wonderful benefits out there. And let's see. So A2A, a little bit more about our Adolescent2Adult program. We kind of have different slide decks for this A2A. We actually can do this presentation directly with youth, and we tend to keep it a little more simplified and really just kind of go over, what their benefits are. So if it would ever be helpful to, if you're, running any kind of group of youth who might all have this Apple Health Core Connections or anything like that, even if it's a really small group, I would be more than happy to do a presentation directly for youth or alumni as well. Or if you need A2A brochures, the front of it looks just like this pretty much. And then the inside has some basic information about what's covered. So if you would like some of these, it's like a half fold or like a half size sheet of paper. If you would like to have a stack of those, I have a slide in here that tells you how you can get in touch with me to request some brochures as well. How are we doing on time? Oh, we're doing great. Okay.
So yeah, I do have a
almost
question.
done there. Oh, great.
In addition to doing this in a presentation to young people, what other topics can be provided or presented to students directly?
So students directly, really just the A2A presentation. The rest of our training topics, like the secondary trauma and self-care and trauma and ACEs, those are really designed for professionals or caregivers who are working directly with youth. We don't have any other topics that we're able to do directly with youth.
Okay, thanks for
great question.
And then the second question was referring back to a few slides ago. Is there a list of the providers that have been trained in the trauma-informed CB therapy?
So a list of providers that have TFCBT. So you can go to the TFCBT website. I think it's tfcbt.org, and then you search by state to see what providers are certified in the state. And so one of the things that happens is once you go through the TFCBT training, it's been a very long consultation process to actually get certified. So, the folks that we just trained in TFCBT this year, they still have to go through that longer consultation period. So you'll only see people who have really completed the process on that TFCBT website. The other thing that you can do, really interesting. I don't know that we have an exact list of TFCBT providers that are in network with us, but that's something I will work on and see if maybe I can find. And if you're the person that asked Donna that question, you can feel free to send me a private email too, and so we can kind of know what county you're working in, and I can try to do some digging for you on your specific county too.
Okay.
Yeah.
Thanks, Lindsay. That person actually had to leave the meeting, but I'll send an email between the two of you and you can connect with them directly.
Perfect. Thanks, Donna. Okay. Any other questions before we move on? Okay. So A2A is our Adolescent2Adult program. Really what we want young people to know is that they have these benefits. If they are in foster care on their 18th birthday, they remain covered for Medicaid through the month of their 26th birthday. So we will often attend the transitional youth meetings with DCYS, and we can share a lot of the Medicaid benefits with youth that way. And then also through A2A, we will call members before their 18th birthday to invite them to join. Basically what it is we go over kind of all the benefits we've been talking about today, things like SafeLink, things like the rewards program, and really kind of make sure they know about all those benefits that are available. So I don't think we showed this in kind of the general kind of benefit slide, but again, we have assistance to help quit smoking. Okay, we can assist with no-cost medications, personal coaching for encouragement and support, and personalized help for teens who are wanting to quit. And that includes hookah, e-cigarettes, and vaping, right? So not just traditional cigarettes. And then I promised I would share a little bit more about family planning benefits through Medicaid. So what those benefits include are birth control, so no cost with a prescription, and over-the-counter birth control without a prescription. So over-the-counter birth control includes condoms. If the youth has Medicaid, they can access condoms without a prescription at no cost to them using their Medicaid card at the pharmacy. So that is a wonderful benefit. I've been asked the question before, how many are you able to access? And I don't know that exact number, but we did have a youth one time who was using that benefit a lot and then handing out condoms to friends and to others at his school. And so eventually, you know, he did reach that maximum, but I think it was a pretty high number. So it's great that that is available. Birth control pills, you know, NuvaRing, Depo shot, IUDs, long-acting birth control like the implant, emergency contraceptive, condoms, spermicide, right? All of those are birth control options that are covered. Pregnancy testing is covered, not an over-the-counter pregnancy test, but if they go to, you know, any provider's office to take a pregnancy test, that is covered by Medicaid. Maternity support services, sterilization. Sometimes people ask a lot of questions about that. If you have a lot of questions, you know, for younger youth and everything, there's quite a lot of processes to access that benefit. If you have questions or a specific case, I'm happy to touch base with you independently on that as well. And then also pregnancy terminations, or again, for any youth who are already pregnant, we have the Start Smart for Your Baby program where they can access that no-cost double electric breast pump and the convertible car seat. And I put this in here. This is actually from our sexual health and foster care training curriculum. But sometimes that question comes up when we're talking about protected health information and kind of what is shared versus what is confidential for youth. So STD or STI testing and treatment. There's the RCW code there. Minors may obtain tests and or treatment for sexually transmitted diseases and infections if they are 14 years of age or older without the consent of a parent or guardian. And birth control, minors may obtain or refuse birth control services at any age without the consent of a parent or guardian. And abortion services, minors may receive an abortion and abortion-related services at any age without the consent of a parent, guardian, or the father of the child. So I just put that in there so you know kind of what the confidentiality laws are in this state around accessing some of those reproductive health care services. Yeah, so there's a question in the chat, do we provide mom coaching? We do have maternity support services. So if the member fills out that notification of pregnancy, we have a couple of different options. If the person is you know, experiencing a higher risk pregnancy, there are some kind of qualifications that have to be met, but they may be able to access in-home coaching or in-home support. And then for other members, we have some, you know, pregnancy kind of coaching and support that is text-based and some that is telephonic-based as well. So mom coaching after baby is born, we don't have any program like that. But what we are able to do is, you know, help connect to resources in the community. So if we hear from a member and they're saying, you know, I'm having a hard time with being a new mom, you know, I really need some support around that, and that's part of their care plan and within care management with us, we'll help connect them to resources that might be available in their community. So again, right, just kind of a general know your rights kind of slide here, right? Youth have a right to medical care whenever they need it and have health coverage through the month of their 26th birthday. They have the right to be respected by their healthcare provider, be informed of all risks and benefits of any medications that are prescribed or recommended, and a copy of all medical records while they were in the custody of DCYF when they exit care. So there's a link there to all of those rights and responsibilities that they have. And again, mental health and reproductive health care are protected, and a signed release may be required to share this information, right? So want to make sure they know that they have that right to protected information around their mental health care and their reproductive health care. So again, enrollment, if you have a youth that is over the age of 18 and they were in foster care on their 18th birthday and they're telling you, I don't have Medicaid coverage, I don't have health services, or you know, I've never heard of coordinated care, right? It might be that they actually do have coordinated care, they just don't know it. And so if that's the case, you can, you know, try reaching out to me and we can help problem solve those individual situations. And if it turns out that the youth is not enrolled with coordinated care and doesn't have Medicaid, but they were in foster care on their 18th birthday, they may qualify. And so the way that they can enroll is through the foster care medical team at the healthcare authority. So there's their phone number and extension, as well as their email address, and we can help make those connections if you're ever running into a situation like that. And again, for those youth who, were not in care on their 18th birthday, but they might really benefit from having Medicaid and don't currently have Medicaid, they can apply for Apple Health or Medicaid by going to that wahealthplanfinder.org website. And on that website, they can also find insurance brokers and navigators for their region. So if they have questions or having a hard time enrolling in Medicaid, they can access navigators and brokers in their region as well. If you work with homeless youth and Medicaid, or if you work with homeless youth and unaccompanied minors and have questions about healthcare coverage for them, you can click on the link to this YouTube video. This was a training that was done just a month ago, so really fresh information through the OSPI Foster Care Mckinney-Vento Liaison Forum. So the Healthcare Authority joined for that. You'll see me doing a very, very brief, condensed version of this presentation in it as well. But the Healthcare Authority started off, and their information goes really in depth for how to assist homeless youth that might need some assistance. Or you can click on that link there to access the slides from that presentation and all the contact information for who to reach out to at Healthcare Authority if you're assisting a homeless youth and signing up for Medicaid are in those slide decks as well. So that's a really wonderful resource if you were not able to attend that Foster Care McKinney-Vento Forum last month. If you want brochures, right, I'm going to put the Safe Link flyer and the My Reward Pays and the A to A stuff in the chat by file drop. But if you want hard copies of those, just shoot me an email and include your mailing address and the number and type of brochures that you need, and I am happy to send those on to you. So I know we're all remote right now, so maybe electronic is just fine, but maybe if you're going back to in person a little bit and it would be helpful to have some of those documents in your office, I am happy to send them. So in just a minute while we're doing Q&A, I will put those in the chat. Let's see. Medicaid Events, oh, that's a good website. We do offer some open webinars to anybody in the public. So, our topics like coping with holiday stress are coming up in November and December. We'll have some more offerings of suicide prevention and secondary trauma and self-care if you can't join Heather's session at 10:30 today. So you can always check our website to look for those open webinars that are available by clicking on that link. I don't think November and December webinars are posted quite yet, but they should be going up here very, very shortly in just the next day or two. So you can keep an eye on that as well. So great place for more information. Yes, okay, so there was a question, do other managed care have similar coverage for youth under 21? When URM or the federal foster care alumni qualify for D26, do they enroll in AHCC or their previous managed care? Woo, okay. So AHCC, Apple Health Core Connections, is just for those youth who are entering the state child welfare system, right? So it is just for children who are entering out of home dependency through Washington State, through our the Washington State court system. So for alumni who qualify for the D26, do they enroll in HCC or their previous managed care? My understanding of the way it works is if somebody was on managed care within the last 6 months and for whatever reason their Medicaid eligibility went away, they are automatically re-enrolled in that same managed care plan that they were previously on. But in general, when somebody signs up for Medicaid in Washington, they can select which managed care plan they want, right? Or they can just select the auto enroll option as well. And so then HCA will just auto enroll them into one of the managed care plans that's in their county. But if they're wanting to select coordinated care or one of the other managed care plans, then they are also able to do that as well. But typically, if you've been on Medicaid at any point in the previous 6 months, they will automatically re-enroll you in that same same managed care plan that you were previously on. So hopefully that answers your question. I am really not an expert on some of those federal foster care types of questions. So there's some information on that in the YouTube link and the slide deck that I had on one of those other slides. And I can also try to help connect you to somebody who can answer more of those questions too. But the other managed care, similar coverage for youth under 21, yeah, those Medicaid benefits, so things like dental, vision, you know, ER, urgent care, all of that, that's really across the board. That's what Medicaid covers here in Washington. So here are the liaisons, right? Michelle covers Eastern and Central Washington. Mariah Familia covers regions 3 and 4, so that is King County and North basically. And then Jen Estroff covers regions 5 and 6, so Pierce County and the Peninsula and kind of southwest Washington. So they really work very closely with DCYF if there's any kind of issues or you know, concerns coming up for a case, and just kind of help troubleshooting those situations that don't get resolved easily. And then again, Heather and I cover Western Washington, and Zia covers Central and Eastern Washington for our community education team. So again, you can reach out if you'd like to set up any training for your individual organization or agency. And again, there's the website if you're looking to join any of our open webinars as well. And that is all I have. 10:03. Okay, perfect. So that leaves some time here for question and answer at the end. And while we are doing that, I will also drop some more handouts and brochures and things in the chat. And again, if you would like copies of any of those, I am happy to physically mail you some too. Just shoot me an email.
Thank you, Lindsay. That was a wealth of information that you provided, and thank you for providing links and handouts. And again, if after the conference, we will be providing a copy of the PDF that Lindsay has uploaded into the chat here, as well as the links that she's provided. So I'm monitoring the chat. Feel free to drop your questions there, and we'll make sure Lindsay gets them.
And I know that was a ton of information. What I usually say too is the key piece here is if you're running into any issues around physical or behavioral health services and you don't know what to do and the youth is in foster care, send me an email, right? Reach out to me and I will help you out. Yeah, but it is a ton, I know.
All right, I don't see any questions coming through. Lindsay, I did get your handouts and I've downloaded them too, so I can share them after as well.
Donna, before you go, I just
yeah.
saw something, Lindsay. For us that are campuses, and we have our health office, counseling health center, and stuff like that. These flyers that I'm looking at that my head is going to like my Office of Diversity that works with a lot of bilingual students. We can pass those flyers out to them.
Yes, absolutely. And all of the flyers that I am attaching right now should be in both English and in Spanish. And if you need other languages, we do have some other languages available for most of those flyers. So send me an email if you're requesting, you know, any other languages as well.
All right, thank you very much. But as I was looking at it, I was thinking that would be cool because sometimes they don't always come to us.
Totally.
Thank you.
Mm-hmm. So I think that's all of them. I think I got them all, and I know Donna re-put in the slide deck already, so thank you for that, Donna. So hopefully everybody has all of the ones they have. I guess I don't have an electronic copy of the A to A because I think we just have this like a nice shiny like thicker material one. So if you want any of those A to A brochures, it looks like that kind of black and green writing, and on the inside it just kind of has little graphics for all the kind of you know, services that are covered basically. So if you want any of those, please feel free to send me an email.
Sounds good. Any other questions? You can feel free to unmute yourself too at this time. Okay, I don't see anything coming in the chat. So I think that concludes this workshop session. Again, Lindsay, thanks so much for presenting today and sharing your expertise and knowledge. And thank you for also previously participating in the Passport Conference and our webinar series. And again, this session is being recorded. So in the coming weeks, it will be uploaded on to the Passport Network YouTube channel for you to view at a later time if you need to refer back to the content. Well, thank you all for joining us this morning. The next session starts at 10:30, so the next session. Bye, everyone.
Thank you.